Acquired immune deficiency syndrome, or AIDS, is a serious condition that attacks the body's immune system. It is the most advanced stage of infection with the human immunodeficiency virus, or HIV. HIV destroys a type of white blood cell called a CD4 cell, which plays a crucial role in fighting off infections. As HIV replicates and destroys these cells, the body becomes vulnerable to a wide range of infections and cancers. AIDS is not a disease one gets diagnosed with immediately after contracting HIV. It is the final stage of a long process that can take years, even decades, to develop. During this time, HIV progressively weakens the immune system, making the body susceptible to opportunistic infections. The progression of HIV to AIDS varies significantly from person to person. With the development of effective antiretroviral therapy, or ART, HIV has transformed from a death sentence into a manageable chronic condition for many people. Knowledge is power in the fight against HIV/AIDS. Diagnosing HIV infection involves a combination of tests that look for the virus or its effects on the body. Early diagnosis is crucial because it allows individuals to start treatment earlier, potentially delaying or even preventing the progression to AIDS. The most common way to diagnose HIV is through a blood test. These tests look for either antibodies to HIV or the actual genetic material of the virus. If an antibody test is positive, a confirmatory test, such as a Western blot or an HIV RNA test, is usually performed. Another important test used in the diagnosis and management of HIV is the CD4 count. This test measures the number of CD4 cells in the blood. As HIV destroys CD4 cells, this count goes down, indicating a weakening immune system. Viral load is another critical measure in HIV management. It reflects the amount of HIV present in the blood. Regular HIV testing, along with CD4 count and viral load monitoring, are essential for the effective management of the disease. The initial stage of HIV infection, often called acute HIV infection, can be surprisingly deceptive. Many people experience no symptoms at all, or they mistake the symptoms for a mild flu or other common viral infection. Symptoms during this early phase, if they do occur, usually appear within 2 to 4 weeks of exposure to the virus. They can include fever, headache, sore throat, swollen lymph nodes, muscle aches, rash, and fatigue. However, even though symptoms may be mild or absent, HIV is actively replicating in the body during this stage. In fact, the viral load during acute HIV infection is typically very high, making transmission to others more likely. Early diagnosis and treatment are essential to controlling the virus, protecting the immune system, and preventing transmission to others. Following acute HIV infection, the virus enters a stage known as chronic HIV infection. This stage is characterized by a prolonged period where the virus continues to replicate, but often at lower levels than during the acute phase. This period can last for many years, even a decade or more, with or without noticeable symptoms. Many people in this stage feel relatively well and may not experience any severe symptoms. However, it's important to remember that HIV is still active and can be transmitted to others, even in the absence of symptoms. Antiretroviral therapy, or RT, can significantly suppress viral replication, keeping the viral load low or even undetectable. This not only helps protect the immune system from further damage, but also dramatically reduces the risk of transmitting HIV to others. With proper care and management, individuals with chronic HIV can live long and healthy lives. AIDS, the most advanced stage of HIV infection, develops when the virus has severely damaged the immune system, leaving the body vulnerable to a wide range of opportunistic infections and cancers. These illnesses rarely occur in individuals with healthy immune systems, but they can be life-threatening for people with AIDS. A diagnosis of AIDS is typically made when an individual's CD4 count falls below 200 cells per cubic millimeter of blood, or when they develop certain opportunistic infections or cancers. These infections can affect various organs, including the lungs, brain, eyes, and digestive system. Symptoms of AIDS can be wide-ranging and often depend on the specific opportunistic infections or cancers that develop. Common symptoms include rapid weight loss, persistent fever, chronic diarrhea, night sweats, persistent fatigue, skin rashes, and swollen lymph nodes. With proper medical care, including ART and treatment for opportunistic infections, people with AIDS can still live meaningful lives. The earlier HIV is diagnosed and treated, the better the chances of preventing the progression to AIDS. Antiretroviral therapy, or ART, has revolutionized the lives of people living with HIV. ART consists of a combination of medications that work together to stop HIV from replicating in the body. This allows the immune system to recover and rebuild, reducing the risk of opportunistic infections and slowing the progression of the disease. ART is highly effective in suppressing HIV replication, and when taken consistently as prescribed, it can reduce the viral load in the blood to undetectable levels. This means that the virus is effectively controlled, and the individual is significantly less likely to transmit the virus to others. There are several different classes of antiretroviral drugs, each targeting a specific stage of the HIV life cycle. These include nucleotide reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, protease inhibitors, and integrase inhibitors. The specific combination of ART drugs used will vary depending on the individual's needs and the characteristics of their HIV infection. Regular monitoring of viral load and CD4 count is essential to ensure that the chosen regimen is working effectively. Opportunistic infections are a significant health concern for people with compromised immune systems, particularly those with HIV/AIDS. These infections are caused by bacteria, viruses, fungi, and other germs that are normally harmless to people with healthy immune systems but can cause serious illness in those with weakened defenses. Some common opportunistic infections associated with HIV/AIDS include pneumocystis pneumonia, toxoplasmosis, Mycobacterium avium complex, and candidiasis. Preventing opportunistic infections is a crucial part of HIV/AIDS care. This involves taking RT to maintain a healthy CD4 count, receiving vaccinations against certain infections like pneumonia and influenza, and practicing good hygiene to prevent the spread of germs. Treatment for opportunistic infections usually involves antibiotics, antifungals, or other medications, depending on the specific infection. Early diagnosis and treatment of these infections are essential to prevent serious complications and improve outcomes. Regular medical care and adherence to prescribed medications are key to managing these infections. Preventing new HIV infections is a critical aspect of combating the global HIV/AIDS epidemic. While there is no cure for HIV, there are highly effective strategies for preventing transmission of the virus. Some of the most effective HIV prevention methods include safe sex practices. Consistent and correct use of condoms during sexual activity remains one of the most effective ways to prevent HIV transmission. Pre-exposure prophylaxis, or PrEP, is a medication that people at high risk of HIV infection can take daily to prevent HIV. When taken as prescribed, PrEP is highly effective in reducing the risk of HIV infection. Post-exposure prophylaxis, or PEP, is a course of HIV medication that is taken after a potential exposure to HIV. It must be started within 72 hours of exposure to be effective. Needle exchange programs. For people who inject drugs, using sterile needles and syringes for each injection is crucial to prevent HIV transmission. Needle exchange programs provide sterile needles and syringes to people who inject drugs, reducing the risk of sharing contaminated equipment. Mother-to-child transmission prevention. HIV can be transmitted from a mother to her child during pregnancy, childbirth, or breastfeeding. However, with appropriate medical care, including RT for the mother and antiretroviral medication for the infant, the risk of mother-to-child transmission can be reduced to less than 1%. Regular testing. Knowing one's HIV status is essential for both treatment and prevention. Regular HIV testing allows individuals to learn their status and take appropriate steps to protect themselves and their partners. We have made significant strides in the fight against HIV/AIDS since the beginning of the epidemic. The development of effective antiretroviral therapy, or ART, has transformed HIV from a death sentence into a manageable chronic condition for many people. With ART, individuals with HIV can live long and healthy lives, and the risk of transmission to others can be significantly reduced. In addition to advances in treatment, we've also made significant progress in HIV prevention. The availability of PrEP, PEP, and other prevention tools, along with increased awareness of HIV transmission and prevention methods, has contributed to declining rates of new HIV infections in many parts of the world. Despite these advances, challenges remain in ensuring access to treatment and prevention services for all who need them. The future of HIV/AIDS depends on our continued commitment to research, prevention, and care. By investing in research for a cure, expanding access to treatment and prevention services, and promoting education and awareness, we can create a future where HIV is no longer a public health threat.